so we are back with the AAA.
I don't know what that
you
was.
look like this. And I don't know what it was either. We're dancing. We don't look good. All right, so AAA, what does it stand for?
Abdominal Aortic Aneurysm.
All right, what is an aneurysm?
A breakage of the wall.
It's a ballooning of the wall that can break, right? So an aneurysm, I put aneurysm, but that's okay. So an aneurysm looks like this. So it's a part of my vessel that has become weakened over time, and so there's a ballooning out. So our biggest fear here is that they're going to have a rupture. And people think, oh, he had an aneurysm. No, he had a ruptured aneurysm, because aneurysms, you could live like this for a really long time, okay? So we can know that patients have aneurysms, but they have not ruptured, okay? But since this is a ballooning out, it's a stretching of the vessel wall, we know that they are at risk of rupturing that big, giant, aortic, big deal, okay? Ooh. So how does this work, or how would you get this? Because this is a abdominal aortic, so as your aorta comes down, that's what you feel like whenever you lay down, you feel that like pulsating. That's it.
Feel my heartbeat.
Yes, that's actually it. So if you're laying down, you're like, oh my God, I can feel my heart in my stomach. You're supposed to, okay? Like.
Sometimes it bothers me. I'm like, will you
happens.
stop so I can sleep?
Oh, you might want to get that checked out. I feel like that's not okay. So it's an abdominal aortic aneurysm, and this usually happens in Caucasian males.
Sorry, Philip.
Hang on. Older males, so elderly males.
You're good. You'll make it one day.
He's okay. Who have a history of hypertension or smoking. Okay? So if they say you have a 67-year-old Caucasian male with a history of hypertension and a 10-year history of 2 packs per day, okay. We are just a magazine article away from being a AAA, okay? So what happens is we get smoking, which gets all this inflammation, and we have hypertension, which is pushing pressure. So both this and this can cause damage to the intima of my vessel, which can cause it to weaken, and then it gets this huge ballooning out, all right? So what signs and symptoms am I typically going to see of a AAA?
A swooshing sound.
Okay, which is a what?
Brewy.
A brewy, okay. You have a brewy.
I feel like I said that wrong.
Mm-hmm. So brewy means there's turbulent blood flow because this is so turbulent. Yeah?
Your sound effects are on point this evening.
Okay, they can have some abdominal aching. I like that term. Okay. Like something just isn't feeling right. They usually have hypertension, right? They may feel like kind of nauseated or not just feeling so good because they're not getting the blood flow really that they need because this is a ballooning out, which typically kind of decreases our pressure right here as it opens, and then we usually have hypertension, so we're pushing a lot of blood flow through. Is there anything else we could have? If it ruptures, what am I going to see? The number one sign and symptom that you're going to rupture is if they complain of, this is a red flag, so I'm going to write it in pink, obviously.
Obvious.
Low back pain. If you see that and they say anything about hypertension or being an old man or anything like, if it's onset low back pain, your patient's probably rupturing. It's not good. So if it ruptures, we have severe lower back pain. I'm never going to want to watch this video ever. I've made the ugliest faces and movements of my whole life. So severe lower back pain, what's going to happen to my vital signs?
Drop.
What is?
The blood pressure.
You're basically bleeding out into your belly.
Mm-hmm.
So
we'll have ascites.
No, not ascites because it's blood, not fluid.
Rigid board-like abdomen.
What happens to my blood pressure when I'm bleeding out?
It drops.
All right, so BP drops, which gives a compensatory increase in heart rate. And then, yes, they will end up getting rigid board-like abdomen, which is my other red flag. That means I have severe bleeding or peritonitis. So if they get a rigid board-like abdomen, we know that this is a bleed. This is sort of a big deal, yeah?
Yeah.
Okay. What's the, how do we diagnose this? How would we diagnose just the aneurysm?
CT scan?
Yep, we can do a CT scan, we could do an ultrasound. MRIs don't tell as well. But typically a CT tells us a lot about blood flow. If you're questioning on the exam which ones that we do for what stuff, a good rule of thumb is that CT typically looks at blood vessels and blood-like things. MRIs typically look at solid masses. So if we're trying to find a brain tumor, I would do a MRI, because I'm looking for something solid. If I'm looking for a subdural hematoma, a bleed in the brain, I'm probably going to do a CT, okay? What would my treatment be for this patient if it hasn't ruptured? So let's say non-ruptured. We don't want it to rupture, right? So we can either they'll do like a stent kind of thing, or they can put a cage or a coil. So they're going to do something in there so that way if it does like rupture out, it's basically keeping it sort of intact. So they're going to put something around it, or they can coil it. So it's almost like kind of doing like little sutures on the inside, but they do it with metal instead of like a suture, okay? So they're going to do something, or they can do just watchful waiting if it's small, okay? We'll say that, okay, come in every once in a while, we'll keep re-imaging it. However, if you have severe lower back pain with low blood pressure, high heart rate, a big rigid board like abdomen, or low back pain, you probably need to come in, okay? Now, if it ruptures, what's my treatment going to look like?
Emergency surgery.
Yeah, we're going straight into surgery. That's a notify the physician, get them into surgery very, very quickly. Let's get moving, okay? Nursing care for this patient would be, of course, first, lifestyle modifications. We have to control their hypertension. How come?
Because that's what's causing pressure.
That's what's causing the pressure, and if we're pushing high amounts of pressure through this weakened vessel, we're going to rupture like that, right? Mm-hmm. So antihypertension meds, what kind of diet would we want them on?
Low sodium.
Low sodium diet. Okay. What else do you want to do for them? Tell them to?
So we tell them not to be like erratic and like activity.
No, they can do activity. I mean, don't let somebody bust you in the abdomen, right?
Boxing, not a good choice. But you're also old, so you probably shouldn't.
Yeah, they shouldn't be anyway, but you never know. So control best we can. That's all we can do. Yeah. Mm-hmm. And then watch for signs and symptoms of rupture, because we need to get them into surgery ASAP.
Mm.
Yeah?
Yeah.
Okay. So if they just have a AAA, are we going to do surgery?
No.
If they have a AAA rupture, are we going to do surgery?
Oh yes.
Oh, yes.
Yes.
All right. Questions on that? Easy enough?
Easy enough.
Okay. Next thing. I'm going to take, I'll take a picture. And we'll post all the pictures on the Facebook site too.
You wanna
And
keep
that
going
one?
on this?
No.